Virginia's nursing homes have been ground zero for the COVID-19 pandemic, but now that the majority of residents and staff members at long-term care facilities have been vaccinated, many families are wondering when they're going to be able to visit loved ones without having to keep their distance or talk through a window.
New at 11, an update to a Problem Solvers investigation. What happened after our Melissa Hippolyte started to ask questions on behalf of one family, and how far away Virginia could be from lifting visitation restrictions entirely.
Okay. That hair is getting long.
Yours is longer than mine.
I know. Pretty soon you're going to catch up with me, I think.
3 inches. That's all the space Valerie Kelly has to talk to her beloved mother.
It's not the ideal visiting situation, is it? But it's better than nothing.
Shirley Moog moved into this memory care facility in the West End last April at the start of the pandemic when her dementia got worse and she stopped eating. Valerie has never even seen her room.
It's really hard to have a conversation, and the not being able to give her a hug is really hard. Not being able to hold her hand.
Last summer, she says COVID numbers were low enough in the region that she was allowed to visit her mother in the lobby of her Commonwealth Senior Living facility at a safe distance of 6 feet with masks on. But that ended in the fall as case numbers started rising.
And she says, well, let me come out and I'll go for a walk with you. And I have to tell her no, and it's just kind of heartbreaking. I don't know how much longer she has left.
When Shirley received her second shot of the COVID vaccine in early February, Valerie says she felt relief and thought she would finally be able to spend time with her mom in person.
So she should be good to go, right? That's the whole point.
But that has not happened because, according to a spokesperson for the facility, it has not remained COVID-free for 14 days. Valerie is still only allowed to talk to her mom through a window.
We're like almost being forced to take this vaccine. It's like your patriotic duty, but I don't understand if it's not going to change anything. Why?
Residents and staff at Virginia's long-term care facilities started receiving the vaccine in late December after getting ravaged by the virus. 3,618 residents in Virginia long-term care facilities have died from COVID-19, and the state tells CBS 6 it is still recommending nursing homes and similar facilities follow guidelines that were put out in September by the Centers for Medicare and Medicaid Services and the CDC. They recommend indoor visits only if there has been no new onset of COVID cases in the past 14 days, and the facility is not currently conducting outbreak testing. At nursing homes specifically, the feds suggest indoor visits only when the positivity rate of the county where the facility is located is less than 10%. But for both nursing homes and assisted living, they recommend routine outdoor visitations as long as the facility takes into account its outbreak status. Meanwhile, the Virginia Healthcare Association tells CBS 6 VDH is in the middle of conducting a survey to determine vaccine completion rates for residents and staff members. But they tell us it is fair to say a majority of both have received their shots. So when might visitation restrictions be significantly relaxed or completely lifted like they recently were in Tennessee? A spokesperson for Governor Ralph Northam tells us that they are eagerly awaiting new guidance from the CDC and CMS and hope to have an update soon.
She would really like to come out and take a walk with me around and get some fresh air, and I would like that for her too, but right now it's not possible.
Valerie is hopeful the feds and state will put out new permissive guidance soon, now that so many residents have been vaccinated.
Hopefully when we get this out there, more and more people will put pressure on the government. Whoever's making these rules for us to live by will relax them some.
To that point, a spokesperson for CMS told me they are working with the CDC to determine ways to safely increase visitation, and they hope to put out new guidance soon. Also of note, since we reached out to Commonwealth Senior Living, they contacted Valerie this week and told her going forward, she will be able to visit her mother in person inside the lobby, but at a safe distance of 6 feet with masks on.
Working for you, I'm Melissa Hippolyte for CBS 6.